All right. Welcome to the latest webcast in Caring.com's Digital Marketing Academy. Our session today is focused on helping your home healthcare agency optimize online marketing to attract new clients. I'm Denise Grob, a marketing director here at Caring.com, and I'm joined by my esteemed colleague, Peter Droubay, who I'll introduce in more depth in just a moment. Before we dive into the presentation, we want to make sure you know this is a one-way webcast where only the presenters speak, but we want your questions. You can ask them anytime throughout the presentation in the Q&A module or the chat module. And the number one question we get every time is this session being recorded and can I have the slides afterward? The answer is yes to both. We will provide the recording. You may see the red dot. The session is being recorded and we will circulate the slides. You'll get an email tomorrow morning. All right. Peter is our featured presenter today, Peter Droubay, someone I'm so thrilled to have on the Caring.com team. Some of you may be very familiar with him. He has extensive experience in the home care industry, including helping to build both the Senior's Choice and Hallmark Home Care, two organizations to which he trained hundreds of home care franchises nationwide. He's in fact a renowned trainer in sales and marketing with a who's who of corporate America on his client roster and a proven track record in multiple industries. He also owned and operated salestrainer.com for 25 years. So we have a truly top-notch trainer here for you today with a wealth of practical knowledge in the home healthcare space. Let's move forward to the agenda. This is an overview of what Peter's going to cover. He's going to start with the state of the industry. He's going to discuss how you can enhance your agency's online profile and why online reviews from consumers matter. And then he's going to take you through Caring's offering and the value of a partnership with us. And then, as promised, we'll do a Q&A. So without further ado, take it away, Peter Droubay.
All right. Thank you, Denise. It is my pleasure to be here today, and I'm looking forward to talking about a subject near and dear to my heart, which is, working with home health agencies, both home care, the non-medical side, and then home health, the medical side. And today we're going to focus a little bit more on the medical side of agencies and how to market themselves. Marketing and sales online is has been a huge passion of mine since for my entire career. And I really appreciate the obituary there. Anytime somebody reads my bio, it's I kind of feel like, well, I'm not dead yet. So hopefully we're going to add to that. And all I can say about the experience, I have been in the industry for a while, have built numerous companies and worked with lots of others in the home care and in the senior living industry. And all a good resume means is that you're getting older. So I don't know if that's a good thing either. If you've got an extensive resume, you've just got too many years behind you, I think is the problem. So hopefully I can bring some of those years to bear here and hopefully we can have some fun. Let's talk about the state of the industry here to start with. And it is, I'm going to remind you of some things that I know you know, maybe point out some trends that maybe you've been noticing, but maybe haven't completely grasped, or maybe you're on this call, on this webinar because you have seen these trends and you know that these trends are happening, and there are demographic trends, there are technology trends, there's a variety of things conspiring to create some major changes in the industry. So we're talking specifically about home health care. We're talking about, medical home care, mostly Medicare agencies. And we're talking about some changes that are happening, some changing times. The first is on the provider side of things. There's a lot of changes that I know you know about. And we can discuss these more in our Q&A and have a good discussion about it. But as you know, there are increasing options for care. There's more and more agencies to start with, and then there's more and more specialization and competition. So there's a lot going on out there. When I first got involved in the business, each community had a few home health agencies, but it didn't seem, at least at the time, to be as rich of a marketplace in terms of the amount of competition. But simultaneously, we're seeing a real shift in the traditional referral sources. They're much tougher to get in contact with and rely on for a variety of reasons. It used to be when I first got in the business, all of our business came from word of mouth and referrals and professional referrals primarily, meaning that the discharge planners and the doctors and and whoever else was working with seniors and with their patients, with their clients, would refer business to us. And that's how we got our business. There was very little quote unquote marketing. I mean, other than going out in the community and meeting people. We did a lot of golfing and a lot of, talking to friends and a lot of networking meetings, but that was about it. We didn't do any traditional marketing. There certainly was no online marketing at the time because there wasn't really an online, but, and I'm dating myself again, but there wasn't even a whole lot of marketing in the sense of printed materials and advertising, a little bit here and there, but we didn't do much of that. But now some of those traditional referral sources are tougher to establish and rely on. Case managers, social workers, discharge planners, and others just seem increasingly busy. A lot of the places they work, a lot of hospitals and a lot of rehab centers and things of that nature are becoming increasingly tough to get into. A lot of hospitals, you have to register and they don't allow people in like they used to and things like that. Also, a lot of them are increasingly integrating vertically. Hospitals, healthcare corporations are increasingly owning their own agencies and trying to get into the business themselves. And so they're trying to refer within. So that's been a trend that we've seen over a number of years here. That's nothing new, but it's an increasing trend as we see managed healthcare, growing. And then obviously gasoline got poured on the fire here this last year with COVID-19, further interrupted access to referral sources. It's been really tough, as you all know. Well, the traditional networking meetings haven't happened, right? The traditional health fairs, the health fair that the local hospital chain always put on and everybody used to go to and meet everybody and establish some referral sources and things like that. Those typically didn't happen. Many of them went online, if at all. But also just walking in and getting to know your local discharge planners isn't happening. It's just been tough with COVID-19. So for all these reasons, the provider network, the group of people that we used to rely on to establish and get referrals from are just not as prevalent. And yet we see on the consumer side, we also see a big shift. And that is that more and more consumers are increasingly aware of their options. It used to be that whatever the doctor said you did, you didn't question it. You didn't go out and look for other things other than what the doctor told you. But now people know that they have choices, right? And they're walking around with a computer in their pocket called their phone. And they're constantly Googling and figuring out, well, what choices do I have? Where can I go? And so families are increasingly aware of their options. They don't have to work with one agency. They know that there's competition, that they can go out and find different agencies to help. Also, because of the recent pandemic, they're a lot less likely to purely accept the recommendations. I'm sure you might have been seeing this over the last year and a half. We find people a lot more wary, a lot more concerned about, am I making the right decision with mom or with myself or with my wife or whoever it is they're looking for help for? It's just become one of those things where they're less likely to simply go with the flow. And so they're checking out more options. They're more concerned about things. Now, part of this has to do with a generational effect. Younger generations, and this is the part of the trend that's going to continue, regardless of how we come out of this pandemic, and thank God and knock on wood, we are coming out of this pandemic and things are loosening up and vaccines are out there and things are happening and it's all beautiful and bright on the horizon. But we have a younger set of people, younger generations, who in many cases are driven to look for options. The first element is that we're a very displaced society compared to generations past. People move all over the country, as you know. And there's a little bit of guilt that comes from being a son. I live in North Carolina currently, right? And my mother's in Oregon. There's a little bit of guilt at not being around her, not being with her, not being able to take care of her. And we've talked about bringing her out to live with us and all those kinds of things. But in the meantime, what do? Right? I go online to find options and services for her. If she needs something, I'm constantly online looking at either non-medical or medical home care agencies or other services that she can avail herself of. So younger generations feel a little bit of guilt towards that because they're displaced. They want to help their parents. They want to help their loved ones who are ill or who need a little bit of help at home. And so they go Googling. And by the way, younger generations, that's what they do. Now, we're still talking about generationally, we're talking about the younger baby boomers are still the ones that are taking care of their parents. So people that are in their 60s are taking care of their 80s and 90-year-old parents, right? And they're the ones that these younger baby boomers have learned to use the internet, as we all have. And, I'm part of that generation myself, and I use the internet all the time to look stuff up. Thought that maybe I wouldn't, but I do. And yet it pales in comparison to my children, right? I've got millennial children in their mid 20s, and they do nothing but on the internet. And in fact, I can't get them to make a phone call to save their life, and let alone to go ask for a referral, right? What do? They go Google everything. They Google everything to see what's in the area. They Google everything to look at what options they have, and they often will make decisions based on what they see. So pandemic or no pandemic, right? Healthcare integration or none of that, right? Any of those other trends are going to pale in comparison to the changes that are happening demographically because of the internet. The Gen Xers and the millennials are soon, very soon, some of them already are, the people that are taking care of their family members. And when that happens, the internet becomes the primary modality for deciding and making decisions about what kind of care. And so consequently, in short, there's a big shift in the sources of business. And this shift, post-pandemic is going to continue, whether we like it or not. In the past, when I first started in the business, it was all word of mouth and professional referrals. That's all we did. So on the left-hand side, that's what we did. And pre-pandemic, we were seeing a shift to where 70% of the business in most areas was still coming through these traditional word of mouth and referral-based means. 30% was now going online. In some markets, by the way, some tech-heavy markets, mostly on the coast, right? California and other areas that are very tech-savvy, it had gotten to about a 50-50 ratio, but the traditional means were still there. But the future is that more and more people are going online to search initially, but also that biggest trend, which I've already mentioned, but I'll elaborate on here, is that even if they are referred by the traditional means, even if a doctor says, use XYZ home health care, what do we all do, right? If a doctor tells us to take a prescription of all things, we walk into the waiting room, we pull out our phone and we Google the prescription. And then half the time we walk back in and argue about whether it's the right prescription. That's just the way the world is turning. So even people that are referred by the traditional sources, even when the discharge planner at the hospital says, use such and such home health, you are going to have to expect going forward that people are going to Google that they're going to look it up, that they're going to figure out, do I want to use that home health agency or not, right? And what other options do I have? And so more and more the online is becoming not only the initial place that people look, but also the place they look to verify the referrals that we get offline. And so that's very important to keep in mind. This trend is huge. Now we're in that business, so we track and we see the numbers. We see exactly who is searching. And by the way, we see millions of searches happening. This is definitely a big area and growing. Every single month we see our stats grow. And what we can tell you is that 30% of the people who wind up calling us and interacting with us are seniors themselves. A lot of people think, seniors aren't online. Well, that's not completely true. In fact, some of the stats show us that seniors, again, 65 and older, that have, a decent income, 75K and more, right? The people that are more affluent in our society, 87% of them are online, and that's moving up every single year, right? They are online, and most of the seniors are online. They may not use it as much as a 25-year-old, but they certainly are online. So the seniors themselves, whether it's somebody looking for their own care or looking for a spouse's care or a brother or a sister's care, they are certainly part of that group that we're after online. But we all know that the focus is on the children. And the majority of those inquiries, the majority of the inquiries we get are coming from this person that we've come to know and love, right? This is our market. This is our client. Our client is the adult child of seniors who need help. Most often an adult daughter. Not trying to be sexist, or we just know that this is the way it is, right? Women, you do a marvelous job of taking care of people and the family, and it's usually an adult daughter that winds up taking charge. Sometimes the sons, but mostly the daughters. So we call her Mary, not because, they're all named Mary, but that's the most popular name of that baby boom generation that is still in the driver's seat right now. So we'll call her Mary. Could be Nancy, could be Susan, other popular names. And I'm sure with coming generations, there will be other names that will attach to this avatar, this person that we're after. This is our client. So the question is, if this is our client, what is she like and how do we attract her? Well, the first thing to know is that she's different from most previous generations of women just like her. First of all, she's very busy compared to previous generations, right? Most of this clientele are still working full-time, sometimes more than full-time. Sometimes they have executive or corporate jobs in which they're working 50, 60 hours a week. So very, very busy. She's also part of that famed sandwich generation that we talk about all the time, in that she has older children, either teenagers or young adults still at home that she's still mindful of and still caring for. And she's got parents that she's working to take care of, not to mention, other family members, either siblings or a spouse. And so she's very busy in her caregiving roles on top of her professional roles. Now, she normally doesn't act until there's a medical situation, right? She's just too busy. So she doesn't spend her time talking about senior care until the time comes. And when it comes, she's a bit stressed. She's a little confused. She's pressed for time because of all of her duties and all of her work and everything else she's got going on. But she is also, the other thing to know about her, she's extremely educated and very independent, right? This group of women these days are just incredibly, intelligent, educated, independent. And part of that is that they've developed a mild distrust of professionals. Not that they don't go to the doctor, they certainly do, but they don't always trust exactly what the doctor says. They don't do everything just because the doctor said. And so with that distrust, she does her research before calling. She's the one that walks into the waiting room, pulls out her phone and Googles the medication that she's just been prescribed. So the question is, what's she going to see? She always goes on and does her research. And what she looks for primarily, the number one thing that she's looking for these days, is what other people say, the consumer reviews. And by the way, you're the same way. We'll talk more about this in a few minutes, but we all are now looking for what everybody else says. What do other consumers say? And she doesn't always trust your website. In fact, very rarely. She knows that your website is set up to put you in the best light and to sell her. And she'll look at it, right? She's not opposed to your website, but she doesn't trust it as much because she knows it's biased. And let's face it, it is. So what she winds up doing is looking for third party, what she considers to be impartial authorities like caring.com and some others that either compete with us or work in the market to provide some opinions. So that's who she is. So the question is, if that's our market, if that's who's making the decisions about whether to keep mom with a certain home health agency or to move her to a different one, or even to find a home health agency to begin with, how do we go about attracting her? Well, again, we want to help you win her over. That's what we do. And so whether she's looking for options in the first place, meaning that mom needs home health, and so she goes looking for the options even before mom's been involved in any, then we want her to find you and decide on you. Or if her parent or relatives already been referred to you, we want her to have the confidence to go forward with that referral, to not change who's caring for mom. And that's going to be based on what she finds online. So 3 ways to go about attracting her. Number 1 is you need to build an enhanced listing in directories like caring.com, and I'll show you what that looks like, under the right topics, under home health care. We have numerous different headings in our directory, and I'll show you more about that in just a moment. And the first thing is you want to appear in these directories. Again, people are not looking at individual websites as much as they are the directories of services in their area. They want to compare. The second thing, and almost more important, but you have to do the first one first, right? But even more important than that is you need to increase the number of online reviews that you have, consumer reviews, and you need to manage your online reputation effectively. And so we're going to talk a little bit more about that here in the next few minutes. And then finally, on the back end, you need to build a sales system for converting online leads into clients. And this is not something that we're used to, folks. We're used to getting most of our business that is, referral business that walks in already 99% sold on us. Well, that's not the case anymore. If she's looking you up online and calling 5 different agencies, then she's not sold on you. You've got to have a sales system ready to interact with her and to give her the reasons to work with you as opposed to anybody else. We do a tremendous amount of training for our agencies on how to convert online leads because frankly, a lot of agencies are not very good at it. We've gotten a little lazy, and I put myself in that category because I built agencies and I've seen the effects of doing all our business based on referral and not having the sales muscle to be able to convert people that are a little bit more shoppers and people that are not as sold on us initially. So 3 steps. Let's go through these quickly and I'll give you some tips and some ways to go about this. Let's start with building an enhanced listing. So first of all, caring.com, if you're not familiar with us, we are, in my humble opinion, and we've got data to back that up, we are the #1 senior care resource online. When Mary goes looking online, she's going to find us. And part of it is that we are a directory of services. We include all businesses that work with seniors in a variety of different categories. We have over 80,000 listings in our directory for all types of services that deal with senior care, whether it be residential services such as assisted living or independent living or memory care, or whether it be at-home services such as non-medical in-home care or Medicare agencies, home health agencies, right? We do it all. And there's lots of other categories that people go looking in. We pioneered online reviews, consumer reviews for senior care. And we are the largest repository of those reviews online for senior care. Over 265,000 currently published. And we'll talk more about that as we get going. We also have a team of highly skilled family advisors that will speak to families and direct them in the right way whenever they're looking for help. So people can call us, they can get involved with us, either by typing online and filling out forms or by calling us directly, and our advisors will help them to find whatever it is they're looking for and direct them to the right resources. And then finally, we have a tremendous amount of information, a lot of articles and things that are published that people go looking for. The bottom line is what that creates is a tremendous footprint online. So here's a recent snapshot of the online SEO landscape. Again, the search engine optimized landscape, meaning that what Google and other search engines rank, they call it the natural rankings, right? What they tend to elevate in their searches in those natural rankings. We find that Caring has not only the most number of keywords where we show up #1 or #2, and our search visibility, that's the horizontal axis down here, is 3.5 times the nearest competitors. In fact, in addition to caring.com, the big green circle on the right, we actually own quite a number of other sites that all feed into they either use the same directories or feed into our same call center and lead flow. We own Senior Housing Net and Senior Homes and Senior Advice and payingforseniorcare.com and assistedliving.org and a bunch of others, right? We have a bunch of other sites that we use. Plus, we have affiliates all across the net that either use our directory as a white labeled version. For instance, US News and World Report, you can go looking for senior care on there, and they wind up using our directory or portions thereof to fill their directory. We have lots of other sites that either funnel traffic back to us or that use our directory. So the bottom line is we have huge presence online, and she winds up finding us. Now, when she's looking for home care services, we actually have 2 different categories online. We have private duty non-medical that are listed under in-home care. Lots of articles to differentiate it. People don't always differentiate it, so sometimes we get traffic coming to either one for the other. But you can go looking under non-medical in-home care. And for instance, on the left, I did a quick search of Arlington, Virginia, and that's what popped up under the non-medical. But we also have another category for the medical side of the business, home health care, medical side or the Medicare agencies. They're listed under home health agencies, and it's a different list. You can be in one or the other or both, depending on what you do, right? That's your choice. A lot choose to be in both. If you are just offering medical services, billing to Medicare and other insurances, then you should be in the home health. If you're just offering non-medical private duty services, then you should be in the non-medical or the in-home care side. And if you do both, then you should be listed in both areas in order to get that traffic. Now, to give you some idea of the presence, this morning, in fact, I ran just 5 sample cities. I could have gone on, but I knew I didn't have room on the slide for it. So I just ran 5 random cities to see, well, where are we ranking? And by the way, we don't rank number 1 in every single city or municipality or town, but it's pretty darn close to that. And in fact, when I went running it this morning, the first 5 that I typed in, we were number 1. So I typed in San Diego, Denver, Philadelphia, Jacksonville, Florida, Dallas, Texas, number 1 in the search engine optimized rankings, the natural rankings, number 1 in every one of them. And by the way, those natural rankings are where people go. Yes, there's ads up there, there's map packs and those things that when you do a Google search, but the majority of the people wind up looking at the search engine optimized rankings. And obviously, if you're in the top spot, you get the most traffic. So if you want to be in that top spot, right, you need to ally yourself with somebody like Caring.com. And there's others. You should be in every directory that's out there because people are searching and they're looking for comparative directories. Ours happens to be the largest and the most trafficked, but the bottom line is you should be in every directory that's out there in order to showcase your business. Now, in our directory, we have a difference. We're kind of patterned after the old phone book. I am dating myself a lot in this webinar. I guess I used phone books in my life, and if some of you are younger, you may have never used one. But phone books, if you remember, they were built on a platform where they would list everybody. Their whole goal was if you're in business, and we know you're in business, then we'll put you up there. But it was what they call a basic listing. It was just your name and location. That was about it. We're the same way. If we know you exist, we put you up there, right? It's a service to the consumer to be able to give them that information about who's in the market. Now, we're not perfect at it. We don't know every business that exists, and some open their doors and we don't know that it happened, but we try our best. But a basic listing is just that, right? If you remember the phone book, it just had a name and an address, and then all around it were ads for people that worked with the phone book. In other words, there were inline ads and quarter page ads and half page ads. And we're very similar to that in a sense, in that a basic listing is just the basic information. Down the middle, you see some examples of basic listings. And over on the right of the screen, you'll see what a basic listing looks like when you click on it. It's got typically a stock photo. There's very little information because we're not partnered, so we don't have informations and descriptions and things like that. And all around it are ads for other providers that are partnered with us. And so we want to make sure that you are in there as a basic listing. That's a free listing on our site. We want to make sure you have all of your locations listed as basic listings, but that's not where you want to stay. What you want to do is you want to be what's called an enhanced listing. An enhanced listing is almost like a little website within a website, meaning that within a structure that we provide, you have lots of options to put and showcase your brand. You can put in multiple pictures, so certainly your logos, and if you have different descriptive pictures of your staff and things like that, all right, whatever pictures you want to put in there, you can put in multiple pictures. There's an extensive description that you can write and put in there along with a whole bunch of Q&A checkbox items of things that you offer that you can put in there. Your phone number, a trackable number. It's not your phone number directly because we want to be able to track for you all the calls that come through. So we put it in a number that rings directly to you and we track it so you know exactly who called and what time and what phone numbers they called from. Your website, your address goes in there. And most importantly, there's no ads around for other providers. When they click on your listing, it's just you. So again, it's almost like a little mini website within a website. You'll see on the left over here, there's rankings, and that's what people wind up doing. They wind up looking, in this case, this is Phoenix, Arizona, and they'll click on 1 or 2 or 3 or 4 or 5 of these agencies in order to figure out what's going on. And you want to be able to be presented a good branding for your agency with all the information and no other ads around when they pop in here. So you want to be in the best light. That's an enhanced listing. So here's the first question to ask yourself when marketing to this new generation, this new wave that's coming our way. Already here, again, because of COVID, we kind of had a bonfire going of this to begin with. people looking online, and a lot of that's here to stay. So the big question to start with is, what will her impression, again, this is our avatar, Mary, this is the person looking for home care. What will her impression of your agency be when she sees your current listing in our directory? She's going to see your listing in our directory long before she ever finds your website in most cases. And the reason is simply because we rank highly when she does searches, and because she's looking for the kind of content that we offer, and she wants to compare. And so she winds up looking at those directories and clicking on the listings there. So she'll wind up seeing your listing. So the question is, what's she going to see? Is it what you want her to see? Does it present you in the best light? That's the first thing that we can do for you, and that we want to do for you, is we want to enhance your listing in our directory and make sure it appears under the right categories. If you're a Medicare agency, medical, home care, we want you under the home health care listings so that she is able to accurately find what she's looking for, and you're able to get the right kind of clients coming your way. The second thing that you need to pay attention to and focus on heavily is your reviews and your online reputation. And even though I'm the one speaking, the true expert in this is the person that introduced me, Denise Grob. She's helped to build and manage our online reviews program, which is the finest in the industry. And she's just done a marvelous job. And it's so important because, you know what, recent survey, Bright Local in 2019, and I would guess that it's increased since then, 8 in 10 people are trusting online reviews as much as personal recommendations these days. And when I first saw that statistic, I thought, no, that can't be true. But then I started thinking about my own behavior, and I thought, you know what, it is true. I do the same thing, right? Even if a friend tells me to do something, I go online, and if everybody else hates it online, I actually start to question the judgment of my best friend. I trust the online reviews as much as my friends. I know that my friends can make mistakes, right? You know, the funny story I tell a lot is that, you know, about a year and a half ago, 15 months ago or so, Christmas time, our dishwasher went out. We had to buy a new one. My sister-in-law, my wife's sister, told her to buy a certain dishwasher. She looked it up online. The reviews were terrible. And she said, oh, we're not buying that one. And I said, but it's your sister. And she said, yeah, but my sister's wrong all the time. So it's we went with the ones that were rated highly online by consumers. Check this out. Of people 55 and older, 71% read online reviews of local businesses. That's you, right? 52% won't use a business that has fewer than 4 out of 5 stars. And they read an average of 7 reviews before they feel like they can trust a business. So if you're sitting out there with just a couple reviews, there's not even 7 for them to read, it becomes a challenge, right? So how do we fix that? Well, in addition to that, let me show you what's happening out there online. So you just saw this listing in Phoenix for, you know, MD Home Health. What's happening is, even if they get a referral from a doctor that says call MD Home Health, they'll go Google it. So this morning, again, just to show you, I Googled them. I just put in their name in Google. And what happens is that obviously they pop up, you know, they're number 1. By the way, we're number 2 in here, if you can see that. But we're number 1 up, or they're number 1 up here. But this isn't where people are clicking when they're Googling a name specifically. Interestingly enough, they're not going to the website. They assume the website will sell them. What they do is they come over here to the Google summary. There's this summary that pops up on the right, and they go down here, and the number 1 things that they're looking for, they look at the photos, but they also, number 1 thing they look for is the reviews. And if you look down here, caring.com has the most reviews. If they click here, which many of them wind up doing, right? They'll come right down here as you watch them heat map. They'll look for the reviews. They'll click there, 41 reviews, and it takes them right to their listing on caring.com. Often that's what's happening, and it's happening increasingly. It's the pictures, the reviews that get the most clicks. So you need to make sure that both are stellar, that you've got great pictures out there, and more importantly, you've got great reviews. Okay, I call it the modern day drive-by. You know, it used to be that people in real estate, whether it be senior living or buying a house or even businesses, they would often drive by to see if they wanted to go in and check it out. Right? You've done this, you know, especially if you're my age or older. You've driven by places to decide, do I even want to go in that store? Do I even want to check that house out, or that senior living community? Right? So it's the drive-by to see, do I really want to engage? Well, guess what? The modern day drive-by, that drive-by is still happening. It's just not happening in a car. It's happening online. And according to Google, again, this is their stat and they've got an axe to grind here. So maybe it's skewed slightly, but it's pretty accurate. 90% of today's buying decisions are being made before contacting the business. Let me say that again. 90% of today's buying decisions are made before contacting the business, meaning that they go on, they look at your listing, at your reviews, at how you're ranked, and they decide, I'm going to use that business or not before they even call you. So the bottom line is you want to make sure that you're benefiting from that drive-by, that you're in position to capture those people that are driving by and deciding whether to stop in. So how do you do that? Well, when you have a listing on caring.com, whether it's enhanced or not, there's a write a review button on every listing. And you can run campaigns right to this link, either email or social media or however you want to do it. You can have people go right to this link and provide a review. Now, unlike many others out there in the market that offer reviews of various sorts for different things, right? We have a team of people and strict standards that actually curate these reviews. We actually take a look at them, make sure that they're actual consumer reviews. We won't take reviews from the business owner, for instance. We won't take, ex-employees trying to trash you or, things that are from competitors and all that kind of stuff. We're very particular about it needing to be a consumer review, either the recipient of care or their family members that were directly involved. So the bottom line is that, we do our best to curate those, and we have a process for being able to contest reviews that I'll talk about in just a moment. This team of people is vital to your success in managing your online reputation. So whether you're enhanced or not, you need to start building your reviews online through this link here. Now, when you're enhanced, we do quite a bit more, but we'll get to that in just a moment. Let me tell you this, that in our directory, you can control the rankings in our directory based on the number of reviews. In other words, we put all of the enhanced listings first. So that's number one, is if you're partnered with us and you're an enhanced listing, that means we have information from you. You've got a description, pictures and things like that. Obviously, we'll put those at the top. But then within that tranche of listings, within the enhanced listings or within the basic listings, your rankings are based on the number of reviews that you have. So you'll see in this particular one, this was in Maryland that I ran this search. You'll see that the number one has 45 reviews. The next has 8 reviews, and we go down to 1 review, right? So you can literally manage to move up the rankings based on how well you're managing your reviews and your online reputation. We also offer a Caring Stars badge that I'll talk about that shows up as well on your listings and helps promote traffic as well. Now, here's what I was talking about a minute ago is for our partners, every time somebody puts in a review, you get notified. And that notification by email, and you can specify email or text and exactly what's going on with it. You can see the review that's there, and you've got a couple of links down here. One is to publish a response. That is vital these days. The more you can respond to reviews, whether positive or negative, even if it's a positive review, just saying thank you and responding in a very professional way is phenomenal. And same thing with negatives, right? People don't necessarily want every review to be, meaning people looking at your reviews, they're not exactly looking for all of them to be 5 stars. They understand that that's not the real world. What they do want to see is that if there's any negatives, that the business has responded in a very professional and good way to that comment, right? Whether it be, if it's negative, that they've responded in a way that helps. So you need to publish responses. So you get these emails where it's just a one-click link to publish a response. Now, we're also allied with several other services through which you can manage and respond to reviews that way. But this becomes a very easy way that you'll have as an enhanced listing. You can also contest the review. If there's factual inaccuracies or if you know it came from somebody not a client, you can contest it and we will investigate and see what the truth is there. And if necessary, we'll pull it down if it's not an accurate consumer review. So excellent way to manage your reputation directly through partnership with us. We also then have a team of people I mentioned that will help you to collect reviews by phone. There's a toll-free number you can get to have people call in, speak to a live body, a live voice, who will do a quick survey, a great client satisfaction survey. They will transcribe that, and that review goes up. And also we have collateral that you can hand out. It says review us on Caring, all these postcard and flyer type handouts that have that number on it, you can hand out and get people calling. It makes it very easy, very simple for family members to do that. And our team of people will even work with you. And even if we need to call outbound with permission a few times, we can do that as well. So the bottom line is this team of people is there as a resource to help you to manage your reviews online. And then we have partnerships with people like Home Care Pulse and others who will feed reviews in as well with your permission. So it's a tremendous opportunity to grow the number of reviews that you have, which is critical for you regardless of where your standing is right now. To grow your reputation online, you need more reviews, you need to respond to more reviews, you need a higher quality of reviews. The bottom line is the more you can manage that end of your business, the more you're going to see your business flourish in the coming years as younger generations go looking online. Now, we also have this Caring Stars Award, which Denise and her team are in charge of. We award it every year to the people that are managing their reviews, both gathering and managing reviews effectively. There's rules and things for doing it, listed on our website. So I'm not going to go into every detail of the rules right now, but this is something that you should aim for and set a goal to win this year, right? You can definitely do it if you put your focus on it. Over the last couple of years, our partners that have the Caring Stars Award, they've averaged twice the number of inquiries and 3 times the move-ins for senior living or the acquisition of clients for agencies. So the bottom line is that you want this Caring Stars Award. You want to make sure that you're winning it because it shows that you're managing your online reputation effectively. So that's the second question I have. So we have this new population of people looking online. Mary is our avatar here. We already asked you if she's going to go looking, what's she going to find? What is she going to see in the directories like ours? And is that listing proper? But then the next question is, based on your current reviews, is Mary likely to call you as opposed to your competitors? Again, based on what she sees in the reviews, is she likely to make that decision ahead of time that she's going to work with you? Like we said, Google says 90% of people are deciding even before they call. Will she decide based on your reviews to work with you? And we want to help you to do that. We want to help you to gather reviews and manage your online reputation effectively. The last thing that we'll cover, and we'll get to Q&A, is that then you need to build a system for selling these leads that you get. You're going to get calls. You're going to get people coming in through your website. And so how do you manage that? When you get these calls off your listing or because of your reviews, how are you managing that online flow? Unfortunately, too many agencies are not doing a good job of it. Again, they're used to simply getting a referral from a doctor who's 90% sold. And this person may be largely sold if you've done a good job of positioning yourself, but she's still a bit of a shopper, and so you need to be able to convert that. So we do a tremendous amount of sales and marketing webinars. We have a whole online training course on how to convert online leads into clients. We do a partner blog. There's a tremendous amount of information that we can share with you on how to build a sales system for managing the lead flow that then comes off of this. So in summary, if you want to really compete going forward in this market, it is a shifting market. And so how do you do it? We invite you to build an enhanced listing on caring.com to bring more traffic in. We invite you to build your reviews and your online reputation and to manage those things effectively. And we invite you to participate in the training we do for how to convert online leads. So what's it all worth? Here's my sales pitch. You can take a look at it and say, is this worth it for my agency? I would tell you that it absolutely is. You got to ask yourself the question of what's the value of every new client, right? If I get more people because I'm marketing effectively online, I get more people calling me, more people hitting my website, what are those clients worth? How much, what's the bottom line to my agency, right? What's the lifetime value of a client for me? And so with that number in mind, you can manage that and say, okay, then what am I willing to pay to acquire clients? And you'll find that we are very, very inexpensive to do that. Our offer to you is very straightforward. If you're a medical home care agency, home health agency, meaning that you offer medical services, you're a Medicare agency, then our offer is very straightforward. It's a subscription. We normally charge a couple $100 for subscribers in our directory, but because you're on this webinar and as a special for home health agencies right now, as we are growing this segment of our directory, we'll discount that to $100 a month for the next year. to be a part of our directory, to be a subscriber, and to have all those benefits that I just talked about. If you want to prepay that year, we'll even take more off of that, and it's $1,000 for the year. If you're interested in that, then give the number on screen a call, 855-590-8989, and one of our account executives will help you to get set up with a subscription in your area for under the home health care listing. If you are a non-medical home care agency, we also have a program for that that is has some additional advantages to it. We actually screen some leads and do things for you there. So you can call the same number and inquire about that and be under the different heading. Or if you do both, we can give you a package to be under both headings there. So with that, Denise, I am open to going to Q&A. I'll just end with this, that our promise is that we do great business. We manage our partnerships really well. We want to win together. We want to make sure that your agency grows as we grow, and that we all do this together in a new and changing marketplace. So we hope to be able to partner with you.
Okay.
With that, let's go to Q&A.
All right. So there was a couple questions about reviews. I'll just go ahead and take those real quick.
Yep.
One was, you mentioned the brand new Review Us on Caring handout. That is available for Caring.com partners, and anyone that would like that free handout, you can print as many copies as you like. It's free of charge. Just contact reviews@Caring.com. That's review, and I'll put it in the chat for everybody, reviews@Caring.com. And then the other question was, how do you get help getting reviews, and what's the cost of gathering the reviews? So for our enhanced partners, the extra review services are free of charge, and anybody can contact reviews@Caring.com for help. We'll explain the options. We also have info on the blog. All right, so I'll put that in the chat for those that are asking about reviews. You received a question about nursing agencies versus nursing registries. Can you clarify the offering and how Caring benefits agencies versus registries?
Yeah, and again, in some states, some areas, and all across the country, again, a registry being primarily an independent contractor placement service, right, for nurses, nurse registries, versus an agency being the employer. We treat them the same because we put them in categories based on their offering, meaning that if you are offering home health, regardless of whether it's in a registry model or an agency model, then we will put that there, and you can work with clients on the difference between that, the advantages or disadvantages of either. So to us, we're not as concerned about your business setup, assuming that you are licensed appropriately in your state and that you are doing good business, right? Obviously, we don't want people that are unlicensed, unregistered, et cetera. But if you are doing business above board and doing well, which I assume everybody is on the line, then we're less concerned about the form of your business. We're more concerned about what services you offer clients. So if you offer private duty, non-medical care, will put you in that category. If you offer medical care through nurses, either through a registry or an agency, will put you in that category.
That's great. And then there was a question, a little bit of confusion on, is the enhanced listing included in the price level you discussed?
Yes. Yes, everything that I discussed is included in the price level. You get the enhanced listing, which you get to, again, you get to put in the pictures and description. You can update that as often as you want. Most people don't do it daily, obviously, but you can update it as often as you want with new pictures, new description, et cetera. And you get all the reviews services that Denise talked about. Whether you're enhanced or not, there's a write a review link, but all the other services, the access to the phone team that somebody else asked about, the handouts, the review alerts, and all those kinds of things are part of our enhanced provider package. And then the access to our training courses and things like that are also part of the enhanced provider package. So all of that is part of it. That's the special that we're doing for $100 a month or $1,000 a year that we're offering here today.
Great. And then there was a question about traffic on Caring.com.
Yeah.
I know you'll speak to geos, but besides the millions of visitors we get to our website each month, you want to elaborate a little bit on the information that your team provides to partners?
Yeah, absolutely. So our traffic can be measured in all sorts of different ways. If we're just talking about, views, people just viewing any one of our sites, right? It is in the many millions of people that view. If we're talking about inquiries, meaning people actually clicking on listings and filling out forms asking for help, we're talking about, in the hundreds of thousands each month. Um, we in our call center you know we field thousands upon thousands of calls every single day. We're talking in the nature of 10,000 every single every couple days that we were fielding in there. So traffic can be measured in all sorts of different ways, and what you really want to know is right down to your geography, your area, and our team can supply that for you. I obviously can't go through every geography right here, but if you call our number, we can get you the traffic numbers for your specific area, wherever that might be.
Great. And do you want to talk a little bit about the reporting and support you give on conversion for
Yeah,
leads?
yeah. All right. So, how many of our hundreds of thousands of inquiries will wind up converting into new clients? So, first of all, let's separate medical versus non-medical. So, the medical side of the business, we do not track as accurately because obviously there's all sorts of laws and rules which we adhere to, believe in, and abide by for the trading of medical information. That's why on our medical side, your phone number is on there directly and the calls go to you. And we do not track that beyond that, meaning that we know how many calls go to you. It's up to you to convert that. So I don't have conversion numbers on the medical side. On the non-medical side, we do screen leads. We don't set up clients, right? But we will screen leads to make sure that they have the private pay funds to pay, that that they have the right kind of care that they're looking for, that they're in the right geography, et cetera. And we send those out. And on those leads, we do our best to track, and we get some great numbers from a lot of our partners. We don't get numbers from every partner. Between 30 and 40% are hiring care from somebody, right? We send those out to a couple different, to anywhere from 2 to 4 different partners, depending on the area. And so most of our partners are getting anywhere, around 10%, 8 to 12% is what we tell people. We have partners that are converting 30 and 40% of them, but the norm is around the 10% that people are converting. And again, that's multiple agencies that are doing that. So overall, it's about 30% on the non-medical, 30 to 40% that are hiring somebody of the leads that we triage. On the medical side, we leave that up to you, again, because we don't triage medical leads.
Great. And then there was an excellent question about that introductory offer that you extended to attendees. How long is that open?
So if you call and get in the process, we will honor it for as long as it takes to get that approval or whatever the case is, right? We're at least going through the end of the month, potentially longer. We don't have a definite date that we're ending that on, but it is an introductory offer that we're running right now for home health. We're big on the non-medical side, and we've always had home health subscribers, but we're really looking to grow the home health, the medical side of the business for our directory there, hence the offer. And so I don't have a date specific for you, but if you call and get in process, I will promise you that we will honor it when the time comes.
That's great. Thank you, Peter. And get in process is a good opportunity for them to speak directly with an account executive and get some of those traffic numbers and have an audit of their exact listing.
Exactly.
Okay, great. It looks like we've exhausted the questions, but if anyone thinks of anything afterward, oh, we got one more. What is the regular rate when the offer isn't applied?
So we currently normally charge $200 a month or $2,000 a year if it's paid annually. So essentially, this is a half price offer, but all of our other subscriptions on our site are at least that. We have a couple of categories that are very hotly contested that are more than that. But most of our subscriptions for other verticals that are subscription based are $200 a month or $2,000 a year.
Okay, great. So can you move the slides forward?
I can to our
Okay,
summary
great.
here.
So let's just summarize what we covered here. Peter discussed that there's been a real shift in how consumers are finding home healthcare agencies, and how you're represented online can really determine your agency's success. Your profiles in online directories are easily found by a high volume of consumers that are searching online, and those profiles can be more important than your own website. Online reviews, he covered in depth. We're going to have a series of webinars this summer that goes into even further depth about how they can help you attract and convert new customers. Super influential in search and selection. Peter only touched on some of the stats we have. We have a lot more we can share with you. And we offer listings for both private duty home care, non-medical, as well as home health care nursing services. And we can help you optimize your digital marketing by partnering with us. Let's move on to the contact information. This is how you can reach Peter's team to get in queue for that special offer ASAP. You can call the phone number, email, and just a reminder, we're going to be sending you these slides tomorrow morning along with the recording. So feel free to share it with others on your team. And this is how, if you have any follow-up questions, you can get those answered. We hope you found this information helpful today, and we're going to survey you after this session. Feedback is very important to us. We hope you'll take the time to share your feedback, give us ideas for what more we can cover for you. And then we just got a question on how to be notified for future sessions. Get in touch with this phone number, this email, and ask to be added to our invite list, or visit partners.caring, where we have an events tab that has all of the upcoming sessions where you can register at any time for those. And that is where we'll be hosting the recording and slides for this session as well. Before we close it out, Peter, is there anything else you'd like to add?
No, just that I love this industry. I love you for being in the industry. I love, home care agencies, whether it be medical or non-medical, and senior living and senior care in general. I just think is, just a phenomenal industry. And so, thank you for being in the industry. I also know that, times change and times are changing. So the more that we can all do to prepare for that, and that means taking a look at our online presence in all the ways and shapes and forms that it is out there, that we're going to do better by doing that. So I invite you, if you want to reach out to me or to anybody on the team, again, call the number on screen and we can help you to really build a good enhanced listing in our directory, manage the reviews, and get you some extra training for a sales system to convert them. So thank you very much for being here.
Thank you. Thank you, Peter. Thank you, everyone.